an important people. And I want to apologize for my voice because in the last year I have had several surgeries in the vocal cords because I used to sing. I cannot sing anymore, but I developed nodules, the famous nodules for singers, and now I struggle to speak sometimes. But I hope it's going to be, we can do it without any problem. This is the outline of the presentation. We're going to speak a bit about the background of nuclear medicine in not only in Algeria, but also in the continent, the IAEA mandate and core activities, capacity building tools and programs. We're going to refer a little bit about what the IAEA has done in Algeria, and we're going to talk about sustainability strategies, partnerships and resource mobilization, challenges and recommendations, and we're going to do a roadmap on the expected impact of our activities. In fact, this is a very important topic when we are discussing the current IAEA activities because we do many things. We do a lot of projects, both nationals, regionals, but when we try to measure the real impact that we are having in the community, it's really difficult. I mean, we can do it, but not in a short term, especially when we are talking about health. We need several years to really see the impact of what we are doing. In nuclear medicine in Africa, we have several problems here because we are talking about heterogeneity in the practice of nuclear medicine. And in fact, we are talking about many countries in Africa without a single nuclear medicine department. That's why in many places, we need to work from scratch. And establishing a new facility in nuclear medicine is not only procuring the equipment. That's the easy part. We have to prepare not only the scientific team, the physicians, technologists, radiochemists, radiopharmacists, not only that team. We also need to prepare the framework, the legal framework for that. The country needs to have a legal framework for nuclear applications, and we can support also in that. So they are able to provide the licenses to operate the nuclear medicine facility. So it's really a lot of work. And we need to consider also providing the radiopharmaceuticals that are essential for the practice of nuclear medicine. And for that, we need to establish supply chains that are reliable and can allow the continuous work of the nuclear medicine department. This is just a snapshot of the nuclear medicine in the country. We have discussed this extensively in the last 2 days. In fact, the information that I had before coming to the meeting was really outdated. I had 15 functional nuclear medicine centers, and yesterday I found out that there are 57 with 5 cyclotrons in the country, which is really a big development in the last few years. We need now to update our databases because we had the really outdated information. All this supported by the Ministry of Health, the Ministry also of Energy and Renewable Energies, and not only the national authorities. In order to promote and improve the practice of nuclear medicine, we also need regional agreements. And for this, we have the regular national projects focusing on the needs of the country, but also there are common needs in the countries in the region that are covered by regional efforts like the AFRA agreement. The IAEA mandate, our DDG from the Technical Cooperation Department already mentioned a bit, but we are here to promote the peaceful uses of nuclear technology, especially in health, to support the member states through the Technical Cooperation Program and also the developing and delivering the standards in the practice of nuclear applications. Strengthen safety, of course, quality assurance, and regulatory oversight. Enable sustainable, locally owned nuclear medicine and radiology service. And there are several core programs for nuclear medicine and diagnostic imaging. Of course, we are focusing on capacity building and resource development. And this is done not only through technical cooperation, but also with the regular budget of the nuclear medicine and diagnostic imaging section. We train people. We send fellows from one country to the most advanced countries. We organize workshops and e-learning activities. We have quality management programs, Quantum for nuclear medicine and Quadrille for radiology. We provide guidance in radiopharmacy or cyclotron use and theranostics. By the way, Professor Alavi, we have also another technical document on how to establish a theranostics facility. This is very new. I'm going to send it to you, to your email. And we also work with regulatory and safety infrastructure strengthening. When we talk about the regular budget activities, and I want to emphasize this because it is different from the technical cooperation program. We have some activities developed through the section of nuclear medicine, and we have our human health campus that is an open source, free website in which we have a lot of training materials, a lot of technical documents, guidelines, and all the standards provided by the IAEA in the practice of nuclear medicine and radiology. We have the databases like NUMDA for nuclear medicine and Imagine for all the rest of diagnostic imaging modalities, the programs for quality that I already mentioned, and also some initiatives launched by our Director General, like Zodiac for zoonotic diseases, Rays of Hope focusing on cancer, and the St. Jude's initiatives that are meant to help member states to improve pediatric oncology. Of course, we have the IAEA publication. We have many, and all of them are free. You can download the publications in PDF form and have it in your tablet and your computer to consult whenever you want. And talking about the capacity building tools and mechanisms, I already mentioned the fellowships, and Algeria has provided a lot of support in that regard. We have trained physicians from several African countries. They come here and they are trained in the whole specialty thanks to the colleagues from different hospitals. And now we signed also an agreement to have something called Anchor Center, not only for nuclear medicine and radiology, but also for radiotherapy, medical physics, and we include also a bit of radiopharmacy. We provide equipment, we procure equipment for countries, and we do remote mentoring, telemedicine, and we have many e-learning platforms. And of course, we provide assistance for national policies, staffing models, and clinical protocols. In radiopharmacy, this is a core need in many countries, in all the countries, in fact, because without that, we cannot work in nuclear medicine. We provide technical support for establishing radiopharmacies at different levels, for basic nuclear medicine, for advanced nuclear medicine, for theranostics. We assist with GMP practices in developing cold kits and sterile productions and quality control. And we also try to establish, to help member states with the supply chain for radiopharmaceuticals. And of course, training in quality control and quality assurance and regulatory compliance, which is essential for nuclear medicine. We support the national regulatory authorities with licensing, with inspections. We train the authorities because when we're establishing a nuclear medicine from scratch, then we need to train also the regulatory authorities. Also training on the transport and waste management and radiation protection, implementation of international standards, and of course, we do a feasibility study to see if establishing a nuclear medicine department in a country could be beneficial or not, if it's unsustainable at the long term. education and workforce is one of our core activities at the IAEA. We develop curricula for all the professionals involved in the specialty, support residency programs, continuous professional development, certification, train the trainer approaches. This is also something in which we give a lot of importance. Train the trainer so afterwards that person can train the local staff. And of course, retention strategies. When we train people, we don't want that people to go to another country. They have to stay in the country where they belong. And well, this is the continuation of the case study for Algeria. We, in order to develop a project, and it's not only working for Algeria, for any country or any type of project, we need to define the objective. We need to have different components, like what are we going to do? Are we going to train people? Are we going to procure equipment? Are we going to organize national workshops? What are we going to do with that project? And of course, the outputs of the project. This is the product that we are going to have at the end, at the very end. And all our projects need to see to be sustainable, especially at the long term. And I mentioned before that we have not only national projects, but also regional approaches. And for that, we have AFRA, which is an agreement for most of the African countries. Is the African Regional Cooperative Agreement, and it provides a collaborative platform across Africa for nuclear medicine, for radiotherapy, for all the radiation medicine specialties. We have currently successful regional projects in which we provide a lot of training to many countries. And we share, of course, the expertise from more developed countries with the countries that are not lucky enough to have that type of development. And we promote harmonization of regulatory and technical standards across our member states. I mentioned before that sustainability was something really important for the long-term success of our projects. We need to analyze the cost recovery models, both with public insurance, government subsidies, and public-private partnerships. This is PPP, public-private partnerships, in which we don't fight with the possibility of having private industry involved in our projects when we are talking about the benefit of a country or a region. We also need to check on the predictive maintenance and local biomedical engineering to be able to provide the services for the equipment that we procure, to do an inventory and procurement planning to prevent stock outs. And also we try to increase or develop the local facilities for manufacturing, especially small equipment or disposable equipment. We also need to take care of the environment. So environmental sustainability and waste management is something also really important related to radiation protection, the safe handling and disposal of this short and long-lived radioactive waste, the adoption of waste minimization and segregation practices, training for safe transport and storage of the radioactive materials, and alignment with national waste policies and regional solutions. And talking about that, the transportation regulations are going to change. They are going to be a bit tougher, more difficult to comply, but it's going to be for the sake of the people involved in transporting radioactive materials and radioactive waste. Also, we try to increase the key partners. In the UN family, we work a lot with WHO, with the African Union, regional health bodies, donors, industry. We leverage multilateral funds, grants, and public-private partnerships, engaging with manufacturers for training, maintenance, and local stock, and promote South-South cooperation and institutional twinning. And of course, as my colleagues mentioned before, we have a lot of challenges like sustained funding and budgetary constraints, the workforce shortages and retention difficulties. the supply chain fragility, we saw that during COVID. I mean, worldwide, we had problems to supply the radioactive materials. The practice of nuclear medicine went down 60% during that time, and was mostly because of the chain constraints. The regulatory gaps and variable safety culture, and also the maintenance support for all the equipment that we procure. Of course, well, I already mentioned this. And the recommendations and practical steps, first of all, is develop or improve the national roadmaps aligned with the IAEA assistance plans, implement phase capacity building, meaning training, equipment, quality assurance, sustainability, establish regional isotope supply hubs and maintenance networks, invest in local training of trainers in biomedical engineering, strengthen regulatory frameworks, and integrate all this into the national policies. This is just an example of the roadmap of a project. Could be national, could be regional. Normally, we do the needs assessment, the policy alignment, and then we start the trainings to have, let's say, quick wins, rapid trainings. That will be the first year. In the second year, we focus on procurement of equipment and long-term fellowships, and of course, improve radiopharmacy, either building one from scratch or improve the existing facilities. In the third year, we try to scale services to do quality accreditation and regional collaboration. And we need to monitor our projects, because the impact of what we are doing is very important. It's not only providing something. It's like when I procure an equipment, when I train people, is really having an impact, or everything is the same? Are the patients improving? Are they living longer? Or what are we doing? We need to really keep an eye on that. And of course, the expected impact and the metrics that we use are really important. For now, we have short-term metrics for our projects, but we are working on developing tools for the long-term impact to see if we are really making an impact in the community. And as a conclusion, I can tell you that the IAEA plays a really important role in enabling safe, effective, and sustainable nuclear medicine and diagnostic imaging across the world. Integrated approach by procuring equipment, training people, improving regulation and financing. Algeria has a lot of potential to be a regional leader through the Race of Hope Anchor Center initiative that we already signed the agreement. We have been collaborating for many years. Now we need to strengthen that collaboration. We already made it more formal, and we are going to be increasing that. And of course, having strategic partners, connecting people to be able to get funds, collaboration, and establishing other initiatives. Thank you very much for your attention.